Hello, I'm Linda Worrall, and I've been asked to talk about the history of the Australian Aphasia Association as it celebrates 25 years. What I've decided to do is to not only tell the story of the last 25 years of the AAA, but also describe some of the challenges of the AAA. So, if you didn't know, the Australian Aphasia Association is a Australian charity and not-for-profit commission registered not-for-profit charity that has supported the aphasia community for 25 years. The AAA has always been a collaboration between all sectors of the aphasia community: people with aphasia, care partners, clinicians, and researchers. How did it all begin? I was on sabbatical in the USA in 1999, and I met this lady here who is one of the leaders of the aphasia, international aphasia community. Her name was Professor Audrey Holland. And while I was with her, I read a journal article that described aphasia organisations, and I realised that we didn't have one in Australia. So she urged me to start an aphasia organisation in Australia. And as you can see, that was my reaction. She said, "It will be the most important thing you will do." And it has been. So let me tell you a little bit more about how I started it back in Australia. At the time, I was working at the University of Queensland, and I had two aphasia groups there for speech pathology students to learn about aphasia. And so when I came back to the university, we had our first conference for people with aphasia and their care partners. At the conference, we discussed the idea of starting an aphasia organisation. And the Australian Aphasia Association was born. And it was in that very nondescript room up there in the photo in the therapies building of the university. In the early years, in the first 5 years, we were really just starting everything. We needed a board, and we would have meetings on the phone. We needed a constitution, and I recruited some of my PhD students, Madeline Cruz and Tammy Howe, to help develop a constitution for the AAA. We needed to recruit members. We had annual conferences, and not only the first one in Brisbane, but also in Sydney, Adelaide, Melbourne, and Newcastle. We started a newsletter, and we knew even back then that we needed a website. In the 5 years between 2005 and 2010, we needed to expand the reach of the association across Australia. So we found that having a conference every year was a bit much. So we decided to have them every 2 years. And we had a conference in Canberra, Brisbane, and Sydney in those years. We were very fortunate to have Angela Behrens, who has aphasia, to draft and help develop an aphasia guide for people with aphasia. And she was helped by speech pathologists as well. And the guide is an aphasia-friendly guide. So it's written for people with aphasia. And it not only describes what aphasia is, but it also describes some of the services that are available to people with aphasia in Australia. That guide is still available on the AAA website. We started to get email and phone inquiries and get them sort of going as well. And we also were asked to provide cards that said, I have aphasia. And so that people who were, let's say, in a shop or in a situation where they couldn't verbally explain their aphasia, they were able to give this card over the counter. And again, they are still available on the website. In the middle years between 2010 and to some extent 2020, we had a donation, a $50,000 donation from a family trust. And so we were able to employ a part-time CEO. We had conferences in Melbourne and Perth, and then later Adelaide and Maroochydore. We entered the digital age and the social media age by establishing a Facebook page, and the Facebook is still one of the major ways that the association communicates with people with aphasia. We also had Twitter before it became X and Blue Sky. And we also developed a set of playlists within YouTube where we had compiled videos that were relevant and people had asked for about the AAA and aphasia generally, and that still exists. In the last few years, there's been a burgeoning of activity. The conferences, the first conference of that era was, of course, in the pandemic, and that was the first time that everything went online. Since then, we've had conferences in Perth and Sydney. We've developed a software called Campaign Monitor for email so that it replaced to some extent the newsletter. The downloadable aphasia handbook was developed in association with the Stroke Foundation, and it is available free of charge from the Stroke Foundation if you pay for postage. The idea of this was that every person, particularly in stroke units around Australia, would have access to this handbook from very early on. There was also the PPA guide developed, and that was developed by experts in the area of primary progressive aphasia. And so that they are both downloadable and free from the AAA website. One of the main activities in the last few years has also been to develop a very communicatively accessible website. And so that's been a major achievement. There's been more resources, free resources, put onto the AAA website. there's now this free printable aphasia ID card where people don't have to just have what the AAA had written on their card. They can compose what they want on their card and then print it out for free. There was also these, to celebrate the 25 years of the association, there's 25 ways to raise awareness of aphasia in 2025, because that's one of the major feedback items of feedback that the association has always had, that if people were more understanding of what aphasia is, then their lives would be much better. There is also the free resource of not only explaining what aphasia is in a handout, but also a set of strategies that people can use to communicate with people with aphasia. The AAA has done a great job also in the last few years of connecting in person and online. Not only has there been the conferences, but also the aphasia camps. The annual aphasia camp is at the Gold Coast, and that's the photo of them at their Sailability event. And it has a focus on returning to life after aphasia. The long lunches for aphasia have been around for a few years and are the primary, one of the primary fundraising activities of the association. And what happens at that lunch is that we try to have members of the business community there who are willing to donate money and buy raffle tickets and bid for auction items, as well as find out and listen to people with aphasia. The Zoom groups that were started in the pandemic, the Zoom groups for people with aphasia, continue to be facilitated by our long lunch, by our volunteers, as well as the Care Partners course, which began last year, and that is run on a Tuesday evening for an hour on Zoom for 7 consecutive weeks. So there's also been a lot more activity in terms of participating in international events, such as Rocking Aphasia in June, where you get a rock and you write something about aphasia on the rock. You plant it somewhere in your neighborhood or somewhere where people will find the rock, and then and sometimes people who find the rock will search on the hashtag that you've put on the rock to find out about aphasia. Also, there has been a lot of input into research projects, and the AAA will present at major international conferences. There was the first International Aphasia Day this year, as well as the Primary Progressive Aphasia Day. So those are firsts for this year. So some figures. Since the beginning, there's been 15 AAA conferences where about 2,500 participants from around Australia have attended. Although we have an average of 120 to 200 members at any one time. The membership will vary across the years, and it certainly doesn't always represent the reach of the association through social media and other means. Again, some figures, the AAA, the volunteers field 192 inquiries per year. The aphasia camps, we've had 6 aphasia camps with about 270 participants. The Zoom group has delivered about 648 individual sessions to the groups, and the group size can be anywhere sort of up to maybe 20, 30 people. The Care Partners course, we have run it twice, and we have facilitated discussions with 22 care partners around Australia. The website and Facebook, though, have the largest number of impact, with 5,400 users of our website and 4,600 followers of the Facebook. I said that I would talk about some of the challenges over the past 25 years. The first challenge is that reaching people with aphasia and their supporters is hard. Now, if you think about it, why is it hard? Well, first of all, aphasia is not well known, so people can't find us. So well-meaning health professionals in hospital may use terms like a communication problem, or people might know that they've had a stroke, or they may know that they've had a brain injury, but they don't use the term aphasia. If you use the term aphasia, then all of these services and support will be revealed through the Australian Aphasia Association. Secondly, most not-for-profits are based on a disease and easily attract funding. So motor neurone disease, Parkinson's, stroke, etc., because a lot of the emphasis in there is on prevention of that disease. But aphasia is a symptom. It's not a disease. It occurs across many diseases. So anything that damages the language pathways of the brain creates aphasia. So things that damage the brain can be stroke, a traumatic brain injury from a car accident or something like that, or it might be a brain tumor, or it might be a degenerative disorder like dementia. So our support is across many diseases as well. In addition, it's just one of these things that the way we reach people with aphasia is through communication. And that's the very thing that is difficult for people with aphasia. So it is not the strength of this population. Also, a lot of people with aphasia after a sudden event or even a long-standing event can become very socially isolated. They might withdraw from their community. They might withdraw from technology, Facebook, social media, email. And so it can be very hard to reach them through the usual channels. The second challenge that the AAA has always had is that it relies on volunteers, except for a few years where we had a CEO. Funding for the paid staff is hard to find. No one wants to fund things like a staff member. Mostly grants are there to fund equipment or something like that. It's the people power that keep the AAA alive. But sometimes those volunteers move on, like students, they move on, um, or that they burn out, um, or that they feel as if they've done their duty there, and so they move on. So volunteers are temporary, so there's always a need to recruit new volunteers and to support them. And indeed, we would love to have more volunteers with aphasia, but they need additional support to be involved in the activities of the AAA. The third challenge is there's still seemingly a lot of unmet need. We find that the people who contact the AAA are those whose needs have not been met by other services. So the public health system has usually sort of peters out after people are discharged from hospital. And in some areas, rural and remote areas of the country, there are no speech pathology services. We often also have a lot of recommendations for additional services. We could do so much, but we just don't have the manpower to do it. Also, it's difficult to maintain motivation to provide services when the feedback and the uptake can be quite sparse. People tell us what they need, but then sometimes they have so many other competing issues that they therefore sometimes don't take that up. And therefore also the feedback can be sparse as well. An example of trying to meet that challenge is a campaign that is not run by the AAA, but is supported by the AAA, where there's a campaign to fundraise to develop an international aphasia awareness campaign so that it happens all at the same time across the world. So we know that there are more than 90 people with aphasia in the world. There's something like 100, should be 140,000 in Australia alone. But this campaign that has been running for several months already is trying to match funding that has been committed by the Tavistock Trust for Aphasia. Yet only 15% of the money has been raised. So it's understandable that people may not have a lot of money to donate to aphasia awareness, but most people should be able to show their support by donating just a small amount to show their support. The big question is, of course, will the AAA be here in 2050? I do think it will be here, but I have been struck by the saying, if it is to be, it's up to me. And that's why I have been involved in the AAA over the last 25 years and will continue as much as possible. And I invite you to also be involved, contact the AAA. Thank you.